Hello, everyone. Let's start talking about the portal. I think we've talked about this a lot, but we're going to go ahead and go from the very beginning on this portal for anyone who hasn't accessed it before. The provider portal is a secure, user-friendly, multi-payer tool that allows providers to enter required quality metrics not captured in claims data for specific episodes. You can use the portal, which is the AHIN portal, using your existing username and password, or if you haven't yet gotten onto the portal, you will need to complete the enrollment process to acquire a username and a password. A word to providers who have more than one Medicaid ID number under which they are submitting claims. You will need to enter the quality metrics under the particular Medicaid ID number for that beneficiary, and you will receive separate reports for each of those sites. I think there's been some confusion about that, but if you are submitting claims under a Medicaid ID number, then you'll have to enter the quality metrics for that specific Medicaid ID number under which you're submitting the claims. A PCP or a psychiatrist, an RSPMI provider organization, or a licensed clinical psychologist can be a PAP, but only a physician or a psychologist can sign for the information within the portal. And providers may also access their current or past PAP performance reports, including the detailed episode reports. And this is the only way that you can access your detailed episode reports is through the portal. You may ask, why am I doing this? Well, there are quality metrics that are being measured. There are quality metrics to pass, and those are the quality metrics that are being entered into the portal. And there has to be a 90% threshold for all episodes to participate in gain sharing. There are also quality metrics to track, and those are currently not linked to gain sharing, but will be reported on your quarterly reports. A link to the portal is available through the Arkansas Healthcare Payment Improvement Initiative website. You can click on this section, which says Provider Portal. And a note, this is useful for providers. If you want to get alerts, you can go ahead and enter your email information in here, and that will give you alerts or update you on information. So that's just kind of an FYI. Once you click on this, you will then see this screen. From this screen, you have access to many different things. There's an access to a guide that explains how to use your reports with illustrations. There's step-by-step instructions on using the portal. And there's also contact information for customer support for AHIN and for Arkansas Payment Improvement Initiative. If you already have a username and password, you can click on the Portal Access button in order to access the portal. If you already have a username and a password in order to log on to the portal, you can go ahead and put in your username and your password. There's also a link here. If you don't already have a user password, you can use this link to go to the Advanced Health Information Network Arkansas Payment Improvement Initiative enrollment form. You can complete that form and mail, fax, or email the form as directed on the information. Once you have entered your username and password into the portal, then you are ready to start entering your information. First, you want to select payer and ensure that that's accurate. So you want to make sure that you have the payer as Medicaid, and then the facility name and the provider. From there, you're going to enter the beneficiary's first name and last name, their Medicaid ID number, and their date of birth. Dates of service is the first date of service for this beneficiary after October 1st of 2012. The next question that you'll be asked is, have you previously treated this patient for ADHD? This is based on current active beneficiaries. In other words, they're asking, were you providing services to this patient prior to October 1st, 2012? If you've previously provided services to this beneficiary and they've been discharged but have returned after October 1st, 2012, then you're going to answer no to that question. This will be a new beneficiary. If you answer no, then you're going to be prompted to complete the quality assessment that we're going to look at in a little bit. However, if you answer yes, that you were treating this patient prior to October 1st, 2012, then you will begin to enter information into the continuing care certification. The date at the bottom is going to be the date that you entered the information into the AHIN portal. When you complete the continuing care certification, you're certifying that the beneficiary has been evaluated, that you have provided guideline concordant care, that you are communicating with the PCP. So these questions, you should be answering the questions, and then the name that will be typed under here would be the name of a psychologist or a physician, because those are the only persons who can certify the information on the portal. The other question at the top is this a severe patient who requires level 2 care? If that beneficiary was in care prior to October 1st, 2012, that beneficiary can go directly into level 2 through the severity index. So if you answer yes, this is severe, then from this screen, if you answer yes, you treated them prior to, and yes to the severity, then you're going to go and complete the severity index at the end of this. The severity certification has several questions, and you have to answer one of the questions on here. In order for them to move to level 2, there has to be a rationale for their move to level 2. So either there was an inadequate response to medication management, there were severe side effects of the medication, or there were major environmental or family complications or a high likelihood of medication diversion. Also notice that there's a place where you can type in a free text box where you can type in another reason or an explanation for moving that beneficiary to level 2. If you're completing the continuing care certification, then you actually will not put the signature in until after you've completed the severity certification. So in this particular case, if you're answering no to both of these questions, then no, I haven't treated this beneficiary before, you are going to complete the quality assessment certification. The quality assessment certification requires that you answer questions including that you have completed and documented a vision and hearing test or have confirmed that a vision or hearing test has been completed. The documentation for the vision and hearing test, look under the Child Health Management Systems, the ESPDT. Sorry, my tongue is tied today. Screening, and it has to meet the requirements of that. And you would need to have substantial documentation, or at least documentation within the clinical record of the date and who completed it, and then it was completed according to those guidelines. You also are certifying that there has been a diagnosis in person through an assessment and reports from at least 2 settings, and that you've evaluated this patient for ADHD, and you would choose that you have found at least 6 symptoms within one of these 2 categories. And then that the beneficiary or the patient has been screened for common comorbidities using some type of broadband diagnostic or similar tool. And that you've obtained a family history, including any incidents of the disorder in parents or guardians, or attempted at least to collect this information on family history. And also, of course, that you're in communication and are speaking with or have some type of communication with a PCP. If you're doing the quality assessment, then this would be the place where you would actually sign that with a physician's or a clinical psychologist's name. The portal also has the current DSM-4 diagnostic guidelines for ADHD. So note that the diagnostic criteria requires 6 symptoms in category A or 6 symptoms in category B. It also requires that there were impairments present before the age of 7, and that some impairments from the symptoms are present in 2 or more settings, such as school or work or at home. There has to be clear evidence of clinically significant impairment in a social, school, or work function, and you've ruled out other diagnoses that possibly could be attributed to those particular symptomologies. So we're going to wrap all this up. All new patients entering the episode or seen for the first time by a provider needs to have the quality assessment or the quality assessment certification completed. Even if you believe that even if another provider has entered information in the portal, you still need to enter your own information under your own Medicaid provider ID number in order to be able to participate in gain sharing. So if you don't enter this information, then there's a possibility that you would not meet the 90% threshold that you will be required to meet. So even if another provider has entered this information already, or you believe they have, you will still need to go ahead and enter this information for your own provider ID number. It needs to be completed by the provider who will deliver care or who is delivering care, and it's completed after the assessment in order to initiate treatment. It requires providers to certify completion of several guideline concordant components of this assessment, and it encourages the thoughtful and quality assessment and diagnosis and appropriate diagnosis of any other comorbid conditions that might occur with ADHD. The continuing care is for all recurring ADHD patients within the episode model. And that's beneficiaries who were present. That includes beneficiaries present before October 1st, 2012. It's completed at recurrence, which is every 12 months, and completed by providers who are delivering care. And it is certifying that there is adherence to basic quality or guideline concordant care, and that there's reevaluation and management at the physician's level. And the severity certification is what is required in order to escalate beneficiaries to level 2, whether that's for the first time or whether they are reoccurring at level 2 at this next episode or every 12 months. It's completed at the first escalation and then every episode thereafter, and it's completed by the provider who is delivering care. And it requires certification for those in level 2 by a physician, stating that they continue to be at level 2.